Stroke and management. Stroke is an emergency medical condition in which something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. There are two types of strokes based on the causes. Ischemic stroke, which may be caused due to thrombosis and embolism and have sudden symptoms. Basically, the patient may remain conscious in this type of stroke. The other type of stroke is hemorrhagic stroke, which causes due to sudden rupture of blood vessels. In this type 2, there is sudden onset of symptoms and the effects progress as the internal bleeding progresses. There are also different findings and different terms to describe these findings for different types of strokes. Stroke patients may be presenting different types of symptoms, which are given different terms. Let's see some of these terms or conditions. Half-visual blindness hemianopsia. Sometimes the half of the visual field is disturbed, and this condition is known as hemianopsia. Inability to recognize regular things or agnosia. In this, there is loss of memory regarding the particular objects or people. Different perceptions about the visuals and positions that may lead the patient to lose balance are called proprioception alterations. Inability to perform regular activities, such as walking or making normal gestures, which is known as apraxia. Inability to sense one's own body part or paralyzed side, called Nclex syndrome. As nursing intervention, the important point is to identify the type of stroke and onset of the stroke. Detailed part affected can be found out by using CT scan. Interventions in the acute stroke. The first step is monitoring properly the ABC or airways, breathing and circulation. If the tongue has folded back or if there is any secretions blocking the airways, we may need to clear out air path as well with the help of suctioning. For circulation, basically, we prefer a high blood pressure above normal or 150 by 100 for adequate perfusion. Next, you may need to administer oxygen based on the needs. Lie the patient with head slightly raised above and sideways to prevent aspiration. Then you may need to maintain the fluid and electrolyte balance of the body. Pharmacological intervention. The medical intervention may depend on the type of stroke. There can be different causes of the stroke. For example, if high blood pressure is suspected to be the cause, the possible pharmacological intervention could be antihypertensives, anticoagulants, diuretics, or antiplatelets.